Welcome back to the Gut 360 podcast. I'm your host, Ellie Breacher, a registered nutritionist on a mission to empower you to transform your health from the inside out through evidence-based nutrition and a 360 approach. Today, we're diving into a topic so many women are thinking about, talking about, and often feeling overwhelmed by: fertility. Because whether you're actively trying to conceive now, thinking ahead for the future, coming off the pill, or simply want to better understand your body, there is so much noise online, so much confusion around what it actually means and what really matters. So I'm joined by Ro Huntriss, a registered dietitian with 14 years of experience working across the NHS, private practice, and commercial business. Ro's the founder of Fertility Dietitian UK and has 2 master's degrees in advanced nutrition and clinical research. So she brings both huge expertise and a very practical lens to this conversation. And we're talking fertility nutrition, gut health, the microbiome, male fertility, coming off the pill, and the small changes that can genuinely make a difference. So grab a matcha, get comfy, or throw on your trainers and head outside for a walk whilst you listen to this episode. And welcome Ro to the Gut 360 podcast.
Thank you so much, Ellie. Really glad to be here.
So happy to have you here. Now, I want to start by asking you, fertility can be so overwhelming because there's so much information online right now. What do you think women are most confused about when it comes to nutrition and conception?
I think so much. And I guess it could be different for different people, because some people will be like, okay, now I'm going to start to try to conceive. For other people, it may be, I've been trying for 2-3 years and I've not got anywhere. So there's 2 very different mindsets. And there tends to be a little bit less stress when nothing in inverted commas has gone wrong as such. But I think before people actually get into it, it is a little bit of everything. It's, what should I be eating? What shouldn't I be eating? What supplements should I be taking? What are the most important things? How clean, how strict do I need to be? So these are all the questions that people start with. And then if people are kind of like undergoing investigations for certain things, and then they realize that they have, identified an issue in a certain place, okay, what can I do to then solve that? So it's this really big puzzle, and it's just about fitting those pieces of the puzzle together.
Yeah, definitely. And in simple terms, does nutrition actually affect fertility? Does it make a difference?
It does. And there's a mountain of research to back it up. And I would say, the simplest way to describe it is that, again, when we talk about that puzzle, nutrition is one of those pieces. And nutrition, good nutrition, can basically increase the chances of successful conception. And it can also reduce the time that it takes to get there. But there are instances in which nutrition can be the answer for certain people's issues. So say, for example, deficiencies play a role in infertility. So a folate deficiency, a vitamin B12 deficiency, an iron deficiency, so a vitamin D deficiency. So like if these things are corrected, that can be the answer for some people.
Okay, so if someone wants to improve their fertility naturally, what's a good starting point?
So if we're wanting to do this naturally, like the first thing I would say to do is actually learn about your cycle. So actually start tracking this first, because, information is power. And, when we were at school, all those many years ago, it was all about how to not get pregnant. That was what all the girls were thinking about. And then now, people are in their 30s, 40s, some people are in their 20s. Okay, how do I actually get pregnant? And just even knowing the basics of our most fertile part of our cycle, and knowing when that is, the 5 days leading up to ovulation, the day of ovulation itself. But to know when that is, you need to track your cycle and be aware of the signs of ovulation as well, to help you to understand when this is. So that is a key thing. And then just even looking at the basics. So when we're just looking at a healthy lifestyle in general, if we want to look at things in a really simplistic way, a healthy lifestyle is a fertility friendly lifestyle. So we just want to be looking at and you could do this yourself as well without help from like an expert at this stage. But, having a look at your diet, most people, the vast majority, know the kinds of things that we should be eating more of and the kind of things that we should be eating less of. Start with that. Ensure that you've got exercise, you've got movement in your lifestyle, you're keeping yourself hydrated, you're not having a high intake of caffeine. When trying to conceive properly, the advice is to abstain from alcohol as well. So thinking about all those things, but also, bringing in things like stress management and sleep. All these things play a part, and again, they make up this puzzle. And even, for women who are on a fertility journey, they're trying to conceive, just because of the evidence behind it, I do actually recommend people taking a prenatal supplement to help them along the way. Prenatal supplements, the evidence behind them shows that they are associated with better outcomes in terms of kind of like, the ultimate outcome that we're looking for, which is, like a healthy pregnancy. But even things before that, so in terms of improvement in egg quality, improved AMH, which is like a marker of ovarian reserve. So that can just be, it's quite an easy thing to do, to add, and it can just help to fill any nutrient gaps that may be there. We obviously want to, like, the diet is first and foremost, but prenatal supplements can help.
Amazing. We love easy tips like this on this podcast. And we're actually going to dive deep into practical fertility nutrition in a few minutes. But first, as you know, this podcast is all about gut health. So let's connect the dots here. How are fertility and gut health linked?
So there are a few different ways. And as all your listeners will know, the gut is a fantastic place with many incredible effects. And there are with many aspects of health, there is with fertility too. So examples of this are, the gut plays a big role in how well our immune system works. And our immune system needs to be in a good place to be able to support a healthy pregnancy. There can be the situation whereby if the immune system is misfiring, then when an embryo is trying to develop in the womb, then an altered immune system can think, this shouldn't be here, which can basically stop pregnancy in its tracks. So we need a healthy immune system, which is in part governed by a healthy gut. And also we know that inflammation as well can be a result of dysbiosis and a less healthy gut. And inflammation can affect fertility in so many different ways. So it can negatively influence egg quality. It can influence sperm quality. If we've got inflammation, it can reduce the chance of successful implantation, which is what we then need for a successful pregnancy. So those things, but also the gut plays a role in the regulation of some of the reproductive hormones. So we've got the estrobolome, for example, and this helps to modulate levels of estrogen. So keeping it where it needs to be, so it's not too low, not too high. But then if it is low or high, then this can have an impact on other hormones as well, and can have an impact on whether we ovulate or not, which is the release of the egg, which is obviously one of the things that, again, another piece of the puzzle that is needed for successful pregnancy. And then another way in which the gut can be associated with fertility, micronutrients and nutrients in general are very, very important, not just for the health of the baby, but also in terms of us getting pregnant in the first place. So if we have dysbiosis, if we have inflammation, then the absorption of these nutrients can be a little bit compromised. So we may not get the full absorption. So basically, keeping our gut healthy can help to support a healthy immune system, keep our inflammation levels where we want them, can help to balance our hormones, and can also help with nutrient absorption.
I love it. I mean, I always say the gut is associated with all the different systems in our body. It's so, so important to support our gut health and hugely linked to fertility, as you've explained so clearly. And I'm glad you touched on micronutrients because I actually wanted to ask you, which nutrients matter most when trying to conceive?
Most people will hear about folic acid. This is the one, we hear about vitamin D during pregnancy and then folic acid when you're trying to conceive. So the main reason why we have this public health guidance in place to have 400 micrograms of folic acid in the 3 months leading up to conception for at least the first 12 weeks of pregnancy is that it is known to reduce the risk of neural tube defects. So this is something really in terms of, healthy pregnancy, keeping the baby healthy, but also folate is very important in terms of fertility as well. It plays a role in terms of the maturation of our eggs, in terms of DNA production. And also when we have low levels of folate, we have higher levels of homocysteine, and that is associated with higher rates of miscarriage. So folate, not just for the reason of neural tube defect prevention, is very important for fertility as well. So within that kind of family, folate is very closely linked to vitamin B12. Similarly, and when I was talking about deficiencies before, when we have a deficiency of vitamin B12, this is linked to implantation failure, it's linked to miscarriage. So these are nutrients that we want to ensure that we have plenty of. And it can become even more apparent and important when we have people who are following plant-based diets, because vitamin B12 is found naturally exclusively in animal products. So we just need to make sure that we do have sufficient amounts of it in the diet, either through fortification or, say like if people are vegetarian, they may be having like dairy, they may be having eggs, those kind of things, or again, looking to our supplements as well. Other examples are antioxidants. So there are some key nutrients that are direct antioxidants, so such as vitamin C and vitamin E, selenium. So when we talk about poor egg quality and poor sperm quality as well, oxidative stress is a big reason as to why the quality gets poorer for both egg and sperm. So this is why antioxidants play a huge role in kind of like the protection of our eggs and sperm as well. And then things like vitamin D, I kind of alluded to before, but low levels of vitamin D are associated with high miscarriage rates, poor IVF outcomes. So again, just ensuring that we don't have deficiencies. And this is the thing, deficiencies can lay quite silently. People can be getting along with their day, with their year, with their decade without knowing that they have these deficiencies. But as well as you, or as okay as you may feel day to day, things may not be working so efficiently and effectively inside where we can't see. But I think another thing to point out here is that there's certain, nutrients that have a direct impact and implication on fertility outcomes, but there are others that don't, but they're still important in the preconception period for the health of the baby. So say, for example, like calcium, we know that we need calcium for the bones and the development of our baby, but that doesn't have a direct implication on fertility.
Yeah.
It's similar with choline. Like choline is getting more attention now. So choline really helps in terms of brain development and also plays a role in the reduction of risk of neural tube defects, but it doesn't directly have an impact on fertility. So really, when we are aiming to grow a baby, we need to ensure that our diet is as nutritionally complete as possible, so that even if it's not having a direct impact on fertility, it's supporting the health of the baby.
So important. I love that you touched on those nutrients for the baby as well as for the fertility and pregnancy itself. And let's go through some of those nutrients and talk about where we can actually get them in our diet. So before we even talk about supplements, I know you mentioned a prenatal earlier, but what foods can people be looking for? So you mentioned, I'm going to try and remember everything you said, folate, B12, antioxidants, vitamin D. And then when it comes to the health of the baby, we've mentioned calcium and choline. So let's kind of go through what foods should we be eating?
Okay, cool. So let's start with folate. The best way to kind of like think about this is we find folate in a lot of our green veg. So our green leafy veg, but it's also in things like avocados and things like sprouts. We find it in chickpeas. You'll also find folic acid fortified in certain breakfast cereals and things like that as well. So yeah, in terms of folate, like think green veg, because a lot of green veg tend to have folate. So vitamin B12, as I mentioned before, is found exclusively naturally in animal products.
Yeah.
So if you are, if you eat meat, if you eat fish, generally most people will be fine. But with plant-based eaters, and even so I used to be vegetarian. I'm now pescatarian, and I thought, oh, because I have plenty of cheese and I have eggs, that I would be fine. But actually, I was vitamin B deficient at one point, and I was like, oh, and I felt fine. I didn't feel fatigue. So the only reason that I knew is from doing a test. So I'm now actually pescatarian. I've introduced fish for nutrition reasons, really. But yeah, it just goes to show that those kind of foods may not be sufficient enough. But vitamin B12 again can be fortified in certain foods, so say like nutritional yeast. Again, things like breakfast cereal, some plant-based milks. So have a look on the labels. But I would say for most plant-based eaters, especially if exclusively plant-based, then we do need to be looking at supplementation for vitamin B12.
Yeah, definitely. Really important. And what about antioxidants? Where can we get those in the diet?
Yes. So if we're looking at vitamin C that I mentioned before, again, really, we're looking at largely fruits and vegetables, citrus fruits, for example. We even get vitamin C in potatoes. In terms of vitamin E, so vitamin E is a fat soluble vitamin. So we actually find this in our fats. So things like nuts, avocados, olive oil, different things like that, seeds, a great place to get our vitamin E. And then you also mentioned vitamin D. So vitamin D is the one nutrient that we can't get sufficient amounts of from food. We can find it in some like fish, for example, even in some mushrooms, but we cannot. Basically, it's a nutrient that we can also synthesize through sunlight. So there's public health guidelines in the Northern Hemisphere and in the UK, whereby everybody, regardless of whether they're trying to conceive or not, should be taking a vitamin D supplement over the winter months, because we can't get sufficient amounts from our food, and at that time of year we're not able to synthesize through sunlight.
Really, really important. And then what about the nutrients that are key for the health of the baby? So choline and calcium we've mentioned. Where can we get those through food?
Yeah, so calcium, our main sources are dairy, so milk, and then its derivatives, so yogurt, cheese, things like that. There are other sources as well. So we get calcium in white bread. You could get calcium in, and that will come from the flour. You get white fish and things like you get calcium in things with like fish with bones. So plenty of places there. But again, if people don't consume dairy, it can be difficult. We'll get some in our like green leafy veg as well, but it can be difficult to reach our kind of 700 milligrams, which is like the recommended daily amount. So if you are taking out certain food groups, then think about where you may require supplementation to fill any gaps that the diet isn't able to. And choline, a great source of choline is like eggs. So eggs are a great fertility promoting food. Well, I'd say like preconception food to have. Yeah, for many reasons. And then choline is one of the good nutrients in there.
Amazing. So that's foods. And now what about supplements? We've mentioned a prenatal that contains folate or folic acid. And then what about for women who've been kind of maybe struggling for a few months? Are there any particular supplements that are evidence-based that you would recommend at this point?
Yeah, so interestingly, most or a lot of prenatal supplements will have 400 micrograms of folate. And there's actually research to show that a higher level of folate can lead to better outcomes. So can lead to better IVF outcomes, is associated with lower miscarriage risk. So actually, if people have been, conceiving for some time and dependent on their history, it may be that we recommend having 800 micrograms of folate instead of the 400, and it's still within the safe upper limit. Coenzyme Q10 is one that comes up a lot. Basically, coenzyme Q10 is a strong antioxidant. And, I mentioned before that one of the key reasons of the degradation of egg quality is due to oxidative stress. And coenzyme Q10 is something that can really help there. And interestingly, we as women store coenzyme Q10 in our body. And then as we age, say like over the age of 35, this is when kind of like levels of coenzyme Q10 in our body also decline. And, we know that is the kind of age where certain elements of fertility can start to decline as well. But it's great actually, because there's just more and more evidence coming out about it, meta-analyses, which are the types of studies that combine lots of different studies, but showing that it can improve quality of eggs, improve the number of eggs that are retrieved following an egg collection. So that's either before IVF or for somebody that's doing egg freezing. And pregnancy rates as well. So that's certainly one for people to consider. And then, say, for example, people with PCOS, polycystic ovarian syndrome, can often have issues in trying to conceive. And myo-inositol is a supplement with reasonable evidence behind it to support people with PCOS and to help to manage symptoms and regulate hormone levels a bit. But what I will say with that is you can normally see whether that is having a positive effect for you. So if you've been taking it for 3-4 months and you've noticed no difference in terms of any of your PCOS symptoms, then it's something that you could consider stopping if you're not necessarily seeing the benefits. It's difficult with something like coenzyme Q10. You can't see whether that is having a benefit for you or not. So we just have to kind of go on the best available evidence. But even say like with omega-3 is associated with improved IVF outcomes, and in general health, the advice is to have a couple of portions of fish a week, one of which is oily, and then you'll get your omega-3. But actually, the studies like specifically on supplements, and they tend to fare better, even if you've got the fish in your diet. People who have an omega-3 supplement on top seem to fare better in terms of probability of good results. So that's something that we discuss with our clients as well. And it's our job is to really present the evidence, and yes, we can suggest things, but it's very much a joint decision making in terms of what should we put in our plan and why, and does it make sense for this individual person. But I think another important thing to mention as well is supplements are important in terms of correcting deficiency. So sometimes you may need more than what a supplement can offer. Say it may be that you require a vitamin B12 injection, and that can be done through your GP, but otherwise things can be done through supplements can certainly help. And then that will be dependent on what deficiency or what low level that person has.
Definitely. And I'd add for things like vitamin D, it might be worth getting tested, because if your levels are really low, you'd want to take quite a higher dose than what it says on the bottle. But if your levels are generally fine, you might just want the standard dose that everyone in the UK is advised to take throughout the winter months, for example. So always good to know where you stand. We know we should be consuming fermented foods for our gut health, but have you tried kimchi or sauerkraut? This episode is sponsored by The Cultured Collective, whose kimchi and sauerkraut are naturally fermented, unpasteurized, and tested for live cultures, as well as being a source of fiber. They've won awards for their flavor, so I'm not the only one who thinks they taste amazing. It's really easy to add a scoop of these real live foods to all kinds of meals. I love adding kimchi to the side of my eggs and topping avocado toast with sauerkraut. They're offering listeners of the Gut 360 podcast a huge 50% off their kimchi and sauerkraut, so head to the show notes to find out more. This episode is sponsored by IM8. As a nutritionist, I'm always talking about the importance of a 360-degree approach to health, supporting your gut, energy, immune system, and sleep consistently, not just when something feels off. That's why I've been using IM8 Daily Essentials as part of my morning routine. It's a comprehensive formula with 92 nutrient-rich ingredients, including probiotics, prebiotics, and postbiotics to support the gut, alongside key vitamins, minerals, and antioxidants to help fill in the gaps of modern living. It's not a replacement for a balanced diet, but it's a really convenient way to help support your foundations daily, especially when life feels busy. If you're looking for something simple to support your mind, body, and gut, check out IM8 Daily Essentials. Use the code GUT360 for a special discount and free welcome kit on your first order. Now, another thing I wanted to ask you about, Ro, was a huge topic for women right now seems to be coming off the contraceptive pill and what changes are normal. How long can it take for your cycles to regulate, and when should you be worried?
So we are all different, and what happens for your friend may be completely different to what happens to you. And there's a spectrum of normal. So first thing is, don't panic. We don't expect things to be normal straight away. Your body and these hormones are kind of like having a restart, if you like, and just finding their feet a little bit. But as a general kind of guidance point, in the first 3 months, we would probably expect things to be irregular. And then for a lot of people, the 3 to 6 month mark, we'd start to gain some regularity. For some people, it can take up to 12 months, but generally kind of like within that 3 to 6 months. But it's normal for your body to take its time. It's recalibrating.
And whilst your body is recalibrating, are there any nutritional strategies that can help with this transition?
So I would say it's not that, take this supplement and it's going to make your period, regulate quicker. It's more just that I think sometimes we forget about, what a healthy, balanced diet is in terms of like why it's a healthy, balanced diet and what it gives us. All the nutrients that are in our diet are there for a reason, and many of them contribute to reproductive health. So just as, as examples, zinc can support, ovulation, B6, B12 can help in terms of hormone regulation, like selenium and iodine can help in terms of thyroid health. So basically it's like a healthy diet in general just plays a part. So make sure that you're fueling yourself sufficiently. And this comes about from also like an energy and calorie perspective as well, because if you're underfueling yourself, then like your cycles aren't going to, they're not going to get to where they need to get to. Energy is a really, really important part there. And also just ensure that you're not cutting out any, like nutrient groups from the diet, because it could play a role in things not getting back to where we want them to as quickly as you'd like.
I think it's really important that you touched on not underfueling ourselves, and the same goes with over-exercising as well. So if you are eating enough calories, but you're really overdoing it with exercise, that again can kind of prevent your cycles from regulating at the point that they should. So really, really important. Now, it takes two to make a baby. So let's talk about male fertility, because I feel like this often gets overlooked. How much does nutrition affect sperm health, and what should men specifically be eating if they're planning to start a family in the next few months?
I'm really glad that you asked the question, because we should absolutely be talking about it. And what we're starting to kind of like, build awareness around is, male factor can play a role in up to 50% of cases of infertility. And just historically, this burden, it sits on the shoulders of women, and we have carried it all this time. And it's never about blame. It's never about shame. It's just about finding finding what we should be targeting. Because it's like if a man has a low sperm count, for example, and then the female partner is, driving herself mad, doing all of these things when actually, we should be putting our focus elsewhere. So I think awareness is key in terms of the dietary pattern. And this really goes for women as well as men. A really great foundation for fertility is the Mediterranean style diet. And, one of the reasons why is, well, number one, it's an anti-inflammatory dietary pattern, but it's also high in antioxidants. And similarly with egg quality, oxidative stress is one of the biggest reasons for poor sperm quality. And by reducing things that are going to contribute to oxidative stress in our lifestyle, and by increasing the antioxidants that we have in our diet, it can significantly improve sperm quality. And when we look at sperm quality, there's lots of different elements to it. So there's count, there's concentration, there's motility, so the way it moves, there's morphology, its shape, there's DNA fragmentation, which is about the genetic quality of the sperm. And all of these things can be influenced by nutrition. And it's quite a nice thing actually for men and women in that we have this window of opportunity to make change. So for women, it takes 90 to 100 days for an egg to mature and develop before ovulation. And for sperm, it takes around about 2.5 months for sperm to develop. The egg and the sperm can be influenced in this time. If you're panicking because you're like, oh God, my diet's been terrible for the past 10 years. So what? That's in the past. We can't change that. But what we can do is we can focus on the present and then on the future. And this 3-month window is a really, really great window of opportunity for us to make those changes.
I love that you said that. I think it is so empowering to know that the actions that we take every day can really make a difference, both for the female partner and the male partner. So that's amazing to know. Now, before we wrap up, can you tell us a bit about the microbiomes beyond the gut? I talk about the gut microbiome all the time, but what other microbiomes do we need to know about when it comes to reproductive health? And is there anything that we can be doing from a nutrition point of view to support these microbiomes?
Great topic, and I'm really glad you asked. And I think it's one that's starting to be spoken about a little bit more now, which is kind of exciting. And you're exactly right. When everybody thinks about the microbiome, they think about the gut microbiome. And like as we should, that's where like the majority of our microbes live. However, 9% of a woman's microbes live in her reproductive tract. So there are the two microbiomes that are of greatest, I think, importance and interest at the moment are number one, the vaginal microbiome, and number two, the endometrial microbiome. And I'll come back to those, but just to let you know that it was always thought previously that the upper reproductive tract was sterile, so didn't have microorganisms. But we now know that there are microbes in the ovaries, and then in the fallopian tubes as well, which is just kind of like, it's mind-blowing that we're now starting to understand about these, the environment of microorganisms here. And I'm really excited for the learnings that are to come. And also I should mention that there's also a seminal microbiome as well that can therefore impact male fertility. So there's some really exciting research that's going on there at the moment. But in terms of the ones that are most important for fertility, really are the vaginal and then the endometrial microbiome. And basically, if we have dysbiosis here, it's just like similarly in the gut. When you have dysbiosis, things are kind of like out of whack. And what we need in the vaginal microbiome and the endometrial microbiome is we want to see lactobacillus dominance. And what this does is it creates a slightly acidic environment. And this is the exact environment that we need for reproduction to happen and to happen well. It's the that ideal pH. And when things are imbalanced, then we can get more kind of like anaerobic bacteria that just aren't going to be doing great things for us. And we know that vaginal dysbiosis is associated with higher rates of miscarriage, and dysbiosis in the endometrial microbiome is associated with implantation failure. So it's really important that we do what we can to help to maintain this healthy environment. So it can be influenced by a number of things. For example, the gut microbiome. So if we have dysbiosis there, and then we mentioned before that can impact estrogen. It can kind of like influence like levels of estrogen. It can influence kind of like immune responses, and also kind of like nutrient absorption. This can also have an implication on these other microbiomes. Believe it or not, even things like the activity that we do can influence our microbiome there, and certain elements of the diet, whether somebody's had antibiotics, if people are having probiotics. So all of these things, can have an impact. And what we're kind of like looking into now, and what we're seeing much more of, is people taking lactobacillus dominant probiotic to basically support the environments both within the vaginal and the endometrial microbiome. Because basically, like, the interest here is specifically in terms of supporting implantation and reducing risk of miscarriage. So this is kind of like, so it's a really interesting area, fertility, and one that's got legs, to be honest. So yeah, I think it's exciting, and I'm really excited for what's to come in this area.
That is so fascinating. I mean, there are so many different things to think about. I know when I did your course in fertility nutrition, I learned so much, and it is a really exciting area. And yeah, I'm also excited to see what's to come. So to finish, I would love to ask you, what are 3 quick, realistic things someone can do this week to support their fertility?
Start tracking your cycle. So knowledge is power, as we said. And I'll carry on that kind of like line as well. I think, like, when you're starting, discovery is key. So, do a food diary, start to understand, what does your diet look like now, so that you can understand what your starting point is. And then off the back of that, think about some dietary changes that you could make to get you closer to that, that healthier diet, the Mediterranean style diet, that higher in antioxidant diet, the one that's going to help us along. And the thing is, it's like, what you may choose to do can look very different to somebody else. So it's really looking at, your own picture individually.
Brilliant. So important. We finish each guest episode with a quick fire round. So are you ready?
I'm ready.
What's something that seems healthy but often backfires for your health?
Over supplementing, I would say. This is, I think, something that we see when people come into our clinic, and then some people think, like, the more the better. And people can stack their supplements as well. So they don't often realize that they're having, beyond the safe upper limit of certain nutrients. So yeah, more isn't always better.
That's a good one. What's one habit you see clients struggle with the most?
I think with this, to be honest, it's really individualized. We come in and, in terms of foundation advice, the advice, what we're aiming towards, can be, similar from a foundational perspective, but the things that someone struggles with can be very, very different. So it could be things like alcohol for some people. It could be late night eating for others. It could be, other lifestyle behaviors for other people. It could be remembering to take supplements for others. So I would say it's like, it's quite diverse.
That's true. What's your favorite gut-friendly food?
Kefir.
Love it.
Easy.
What's your go-to breakfast on busy days?
So this may be controversial, but I do follow intermittent fasting generally. It is something that works for me, and I often don't have high levels of hunger in the morning, and I can operate pretty well, and I prefer to often have my calories later in the day.
All about doing what works for you.
Exactly.
What did you personally get wrong early in your career?
I would like to say nothing. The reason why is that, yes, things didn't always necessarily go the way that I wanted, but I think from every failure comes a lesson. So I wouldn't want to go back to the beginning and say, oh, I wanted to do that instead, because it's like, it's led me to where I am now with the wisdom and the learnings that I've had.
I love that. I actually feel like that about life in general. No regrets. Every mistake or failure or whatever goes wrong leads you to where you're meant to be right now.
Definitely.
What's one healthy habit you're still working on?
So again, everything's personal, right? So something that I want to try and explore at the moment as a woman in my late 30s, I actually want to like explore collagen and like collagen supplementation, and to see if it kind of like makes a difference for me. A lot of them are kind of like powdered, and because I don't have I don't have like a hot drink every morning. Like, I'm a bit random with my, a lot of people will have like a coffee, like first thing. I don't have that.
Yeah.
So without that, it can make it quite difficult to get like a collagen in every day. So yeah, something that I'm working on.
Interesting. I would say mix it into your breakfast, but you're not a breakfast person. Because often something like porridge or overnight oats or a smoothie is a good way to kind of blend it in. We'll finish this round with a few fun ones. Coffee or matcha?
Decaf coffee.
Okay. Favorite coffee shop?
I'm just going to go for Urban Baristas.
Nice.
In London.
I like that. Overnight oats or eggs on toast?
Oh, I'll go poached egg and avocado on toast.
Yum. If you could only do one type of exercise for the rest of your life, what would it be?
Yoga.
I love yoga. And lastly, what's one word you associate with a healthy gut?
Diverse.
You're not the first one to say that, actually. Very good word. Well, people have said diversity, which is the same. Thank you so much, Ro, for being a guest on the Gut 360 podcast. If someone wants to learn more about what you do, where is the best place for them to go?
So they can find me on Instagram. So in the fertility realm, my page is at fertility.dietitian.uk. I also have another Instagram page at Dietitian Ro, and that's just about my dietitian life more generally. But if people do want support on their fertility journey, we do have a website, which is www.fertilitydietitian.co.uk.
Amazing. Definitely, guys, go check it out. And thank you so much, everyone, for listening to today's episode. If you enjoyed this podcast, hit follow, send this to someone you know. We all know someone who is thinking about having a family, whether it's right now or in the future. And as we've said, it's never too early to get started and, optimizing our health and eating for our future fertility. So send it to whoever it's going to benefit. And I will see you back here with another episode next Monday.